Good day everyone. Today our class presentation will be on hypothyroidism. Our group 11, entails of 4 members, Aaron Etienne, Ariana Lal Bihari, Akila Thomas, and Crystal Thomas.
Our group was presented with case number 3, hypothyroidism. The case is as follows. A 28-year-old technician goes to her GP complaining of increased irritability and anxiety. Her change in personality has been noticed by her husband and colleagues at work. She feels constantly restless and has difficulty concentrating on a subject for more than a few moments. Her increased anxiety has developed over the past 3 months. She has lost 6 kilograms in weight despite a healthy appetite. She has also noticed an increased frequency of bowel movements. Her periods have become lighter and shorter. She feels extremely tired, sweats profusely, and cannot tolerate hot weather. She has had no significant illnesses previously. She is married with no children. She is a non-smoker and drinks 10 units of alcohol per week. On examination, she appears agitated and her hands are sweaty and tremulous. Her eyes appear prominent with lid retraction. Her pulse is 104, regular, and blood pressure is 130/70 millimeters of mercury. Examination is otherwise normal. Investigations are organized by her GP.
Graves' disease. An autoimmune disorder, one of which is Graves' disease. The immune system attacks the thyroids, causing a hormonal surplus of what the body needs. The thyroid is a gland found at the front of your neck, but developing Graves' disease leads to a dysfunctional cellular wreck. TSH receptor antibodies through thyroid lymphocytes are synthesized, only to target the thyroid itself, the gland from which it was derived. There are predisposing factors that lead to this disease. Stress, smoking, and even gender increases the probability. These factors don't end here. There's also genetic susceptibilities, with focus being placed on the HLA genes. There's also the postpartum period, the 6 weeks after a mother makes her baby. And last but not least, there's the effect of increased iodine. What are some signs that one associates with this disease? Allow us to list some common symptoms of what you may feel and see. Well, there's anxiety and irritability, tremors in your hands, development of a goiter or weight loss that wasn't planned. Bulging eyes, increased bowel movements and erectile dysfunction, low tolerance to heat, and increased perspiration. There's palpitations of the heart and disturbance in your sleep, thickening and reddening of the skin of your feet, known as Graves' dermopathy. Menstrual cycles start to change and you develop fatigue. All these symptoms strongly suggest that you may have Graves' disease. Don't panic just yet. This disease can be treated with specific therapies, following a proper diagnosis and checking the levels of TSH hormone from the pituitary. There's radioactive iodine that can be taken through the mouth, and even anti-thyroid medications that can lower the hormone's amount. Beta blockers that provide a timely relief, and if all else fails, there's even surgery. If you're suspecting that you have this, get tested at the nearest health facility and prevent further progression of this Graves' disease.
What is hypothyroidism? Hypothyroidism, also known as overactive thyroid or thyroid toxicosis, occurs when the thyroid gland secretes excessive thyroid hormones, that is, thyroxine, T4, and triiodothyronine, T3. The sustained high plasma concentrations of T4 and T3 result in an increase in the metabolic rate, and this is evidenced by clinical symptoms such as heat intolerance, sweating, anxiety, increased bowel movements, and weight loss. If you look at the diagram on the right, you will see that there are many more clinical symptoms such as changes in the menstrual pattern as well as difficulty sleeping.
Classification. Hyperthyroidism can be further divided into two groups, and this is based on whether or not the disease affects the thyroid gland directly or indirectly. In primary hyperthyroidism, this relates to the thyroid gland producing large amounts of hormone due to either uncontrolled growth of hormone-producing functional tissue or by way of an autoimmune process that interferes with the normal feedback control. In primary hyperthyroidism, this is caused by Graves' disease, which is the focus of this study, but there's also thyroid nodules, thyroid adenoma, and thyroiditis, which all can cause primary hypothyroidism. Secondary hypothyroidism may be attributed to an overstimulation of the thyroid. This may be due to increased production of TSH from the pituitary gland or TSH secreting tumor. There is also the possibility that overproduction of TRH from the hypothalamus or even thyrotrophin releasing hormone secreting tumor can lead to secondary hyperthyroidism.
Hypothyroidism has several causes. Based on the aforementioned case, main focus will be placed on Graves' disease. Graves' disease is caused by an abnormal immune system response that causes the thyroid gland to produce too much thyroid hormones and is most common in women over the age of 20. Other causes of hypothyroidism includes all of the following: toxic multinodular goiter, thyroiditis, which can be subdivided into three groups as portrayed on the slide, too much iodine, and lastly, too much thyroid hormone medicine.
Today we will be focusing on Graves' disease. What is Graves' disease? Graves' disease is the most common form of hypothyroidism, and it is due to an autoimmune process. The body's immune system mistakenly attacks the thyroid, causing overactivity. It is an autoimmune disease in which circulating thyroid-stimulating receptor antibodies bind to the TSH receptors, stimulating thyroid hormone production and the enlargement of the thyroid gland, gouter. In the diagram on the right, you would see that it is a lovely visual of what was just said. You can see that the antibodies would bind to the receptor, and this would stimulate the thyroid hormone production, and then this would drive hypothyroidism and in the end be the cause of Graves' disease as well as cause diffuse thyroid enlargement.
Physiology. The hypothalamic pituitary thyroid axis, known as the thyrotrophic feedback control, is part of the neuroendocrine system responsible for the regulation of metabolism. The hypothalamus senses low circulating levels of thyroid hormone T3 and T4 and responds by releasing thyrotrophin releasing hormone. TRH stimulates the anterior pituitary to produce thyroid-stimulating hormone. TSH stimulates the thyroid to produce T3 and T4 until levels in the blood return to normal. T3 and T4 exerts negative feedback control over the hypothalamus as well as the anterior pituitary gland, thus controlling the release of both TRH from the hypothalamus and TSH from the anterior pituitary gland.
In the biochemistry of Graves' disease, you would see that T cells synthesized to the TSHR antigen become activated by pro-inflammatory cytokines, which in turn activate B cells to secrete TSHR autoantibodies. The TSHR autoantibodies act as agonists of the TSHR, inducing excessive thyroid hormone secretion, that is T4 and T3. The increase in the plasma concentration of T4 and T3 hormones causes a generalized increase in the metabolic rate, which is seen in clinical manifestations such as increased bowel movement, irritability / behavioral change, fatigue, heat intolerance, sweating, and exophthalmos. Binding of the TSHR autoantibodies to TSHR expressed in the orbital fibroblasts in the eye induces crosstalk, which synergistically induces hyaluronic acid synthesis through the production of ROS. The increased hyaluronic acid synthesis leads to Graves' orbitopathy. In severe cases of Graves' disease, proptosis occurs due to tissue expansion in the orbit and increased synthesis and accumulation of glycosaminoglycans. From the pictorial representation given, it is seen that autoreactive T cells infiltrate fibroadipose orbital tissue following recognition of the antigens. This interaction triggers the production of pro-inflammatory cytokines. This inflammatory response causes the production of ROS, which leads to the stimulation of cell proliferation, adipogenesis, and hyaluronic acid production, causing Graves' orbitopathy.
Diagnostic testing for Graves' disease. Thyroid function test, also known as blood test to check the function of the thyroid. This lab test is requested if patients suffer from hyperthyroidism. A thyroid function test includes thyroid hormones such as thyroid stimulating hormone, free T4 and free T3. These tests include measuring the T3 uptake, also known as thyroid binding uptake, imaging scans, also known as ultrasound of the thyroid, measuring of the T4 and T3, as well as radioactive iodine uptake. Lab tests used to help diagnose Graves' disease. Radioactive iodine uptake can diagnose thyroid disease. The image shows two types, normal and Graves' disease with the paradymal lobe. The thyroid absorbs iodine from the blood and uses it to make thyroid hormone. If the thyroid is making too much hormone, it will take up more iodine. For this test, you swallow a capsule containing small harmless amount of radioactive iodine. After a certain amount of time, the amount of radioactive iodine that has been taken up by your thyroid is measured. If your thyroid is overactive, an increased amount of radioactivity will be detected.
In terms of disease management, there are treatment options which can be used to treat with Graves' disease. One type of treatment is a radioactive iodine therapy, which involves the oral uptake of radioiodine, which slowly destroys the cells of the thyroid gland that produce thyroid hormones. Secondly, there are medicines which can be used. These include beta blockers, which are used in combination with other forms of treatment, as it does not stop the thyroid from producing hormones, but it can treat with the symptoms. There is also anti-thyroid medication, which has proven to be the simplest form of treating Graves' disease, as it reduces the output of thyroid hormones from the thyroid gland. This medication does not provide a permanent cure, but are a viable alternative for persons who are reluctant to take other treatment forms. Lastly, there's the option of surgery, which has proven to be the least used, as it involves the removal of the thyroid gland.
The take-home message for today's presentation. Although several disorders may result in hyperthyroidism, Graves' disease is the most common cause. Thyroid hormones influence many cellular processes in the body, with the most characteristic signs and symptoms associated with Graves' disease include anxiety, irritability, heat intolerance, bulging eyes, sweating, weight loss, and changes in menstrual cycle. With reference to material covered in class, specifically thyroid function and respective diagnostic tests, this aided in interpreting the case study and highlighted the importance of proper assessment and testing.
Group 11 would like to thank you for your time and your attention. Any questions?